So they offer DVD by mail that engaged with its users based on a monthly or perhaps weekly basis. This is analogous to typical approach of healthcare providers, which is touch base with patients only a couple times in any given year. Flash forward to today, and Netflix engages with its users on a daily basis through content streaming, with customers able to access content at home or on their devices anywhere in the world. It's a model healthcare should emulate, said Harlan. The healthcare system looks like my grandparents' old-fashioned cable TV when people want Netflix. You need to expand your mindset and your addressable market. To do so, Harlan suggested thinking about a tenfold increase in interaction per year. The idea is to stop thinking about people as patients and consider them instead consumers who should be known entities to hospitals and health systems before they need care. That's what we can learn from Netflix. This isn't the first time I've heard this concept. This is actually well stated, but it's not the first time I've heard the concept. The question becomes, given it's hard to make the transition, right? It's incentives and payment models and those kind of things. How do you make the transition when, hey, they come in once a year and we get paid X, we want to touch them 60 times this year, and knowing full well that your reimbursement from the payer or your reimbursement from Medicare is not going to cover a majority of those visits. Right. If you're sitting as a provider, that becomes the biggest challenge. How do you get past that?
Well, you become a payer. That's what a lot of them do.
Yeah.
It's interesting if you look at the payer, provider, pharma, like each one of those, when people say healthcare, each one of those is a huge industry on its own, but they all work together. Like, where else do you have that level of, I don't know what, differences? And I've actually, if you think about where things have been disrupted before, it's like supply chain. Amazon becomes its own supply chain. Looking at the pieces between them that's not working, and how do you actually disrupt there? And when you were reading that to me, for the audience out there, you weren't just reading it to me, about how he thought about Netflix, that was where I was thinking, okay, that's actually how to think about it, which is like, what are those assumptions that are wrong? Because the core assumption there was that you can't keep a DVD as long as you want. And Netflix was like, at the beginning, it was like, you can keep it as long as you want. You're just not getting another one, which is brilliant, right? So where's the assumption of that? I think some people have tried to do this, but it's almost like you've got to do it through the entire process. Like, I've seen that the assumption that it's better to have a 10 minutes with a patient than an hour. There's something that you can't do care outside the clinic, but it's almost like each one of those is chipping away at a little thing, whereas Netflix in the beginning kind of just went to the core of Blockbuster's business model.